Progress.
Just a second. Okay. Morning, good afternoon, and a very warm good evening to everyone joining us live across the world. Welcome to July edition of Cheap Talk Africa. Whether you're joining us live across the continent of Africa or tuning in globally, we are thrilled to have you join us today. Thank you. For those who are new to this platform, our initiative is named CHEAP. CHEAP, CHEAP, because we firmly believe in the timeless saying, prevention is cheaper than cure. This simple phrase, prevention is cheaper than cure, is the absolute bedrock of the One Health approach. CHEAP stands for Community Health Enhancement Aid Project. And our vision is simple: building resilient, healthy communities across Africa. Now, CHEAP is a proud initiative of the War Against Rabies Foundation, WARF, a One Health charitable organization registered in Nigeria since 2017. It's been working tirelessly towards a rabies-free Africa. Today, we tackle a monumental and urgent theme: stronger together on the front lines, transforming rabies field experiences into proactive World Rabies Day preparedness. Now, with World Rabies Day just 2 months away, we cannot afford to be reactive. To truly break the cycles of disease transmission, we must bridge the gap between human medicine, veterinary medicine, and environmental health. That is the true spirit of One Health, and we'll keep repeating it until it becomes like a song in our ears. So, to steer this powerful conversation today, I'm joined by an incredible moderating team. First, please help me welcome Dr. Jerome Opanachi. He is the CEO of the St. Jerome Veterinary Clinic and Services, and also team lead, one of the team leads of War Against Rabies Foundation. And co-moderating alongside Dr. Jerome is our student doctor, Sham Sia Abdulmumini from Ahmadu Bello University Zaria. She is a volunteer of the War Against Rabies Foundation. Together, we bring the exact frontline energy and perspective that makes this platform so unique. Dr. Jerome and student Dr. Samshia, it is wonderful to have you both steering today, this ship today. So, Jerome, please, I'm going to hand over this virtual floor to you so that I can formally introduce and kick off our speakers and kick off the session. Thank you. The floor is yours, Dr. Jerome.
So thank you, ma'am, the CEO of War Against Rabies Foundation, and thanks for everyone who has joined, the speakers, our guests, all attendees. Welcome to yet another session. I am Dr. Jerome that she has introduced, and it is my honor to introduce our keynote speaker, Dr. William Tasiame, a rabies researcher, an activist, and head of Department of Veterinary Health and Food Hygiene, Food Security at the Kwame Nkrumah University of Science and Technology, Ghana. He'll be speaking on bridging national field challenges into regional proactive preparedness for World Rabies Day. Dr. Tasiame, I have the floor for 9 minutes.
Okay,
Um,
Yeah, thank you. Please, I hope you can see my slide.
Yes, we can.
Okay.
can we
Yeah,
can we
thank you.
pause a little and get, sorry, Dr. Jerome and Dr. William, can we just pause a little and get the intro, the bio of the speakers? Sorry.
Okay.
Thank you. Thank you very much. So you can, yes. Thank you.
Hello, please, do I go ahead or we are waiting for someone?
Tolu, can you play the bio, please? Can you play the bio? You need to share the volume too. Just before you share, you need to click on the volume as well and share the volume.
DVM, MPhil, Applied Epidemiology and Disease Control. Dr. Arier Nat Veterinarian, Veterinary Public Health Specialist, One Health Researcher, Animal Research Ethics Committee Member. Biosafety, Committee Member, Professional Profile. Dr. William Tasiame is a veterinary public health specialist, senior lecturer, and experienced public sector administrator with over 2 decades of service spanning academia, district agricultural governance, and One Health implementation. He is passionate about the elimination of rabies, particularly in underserved rural communities, where he served as a district veterinary officer in Ghana's Volta region for 12 years. During this period, he led numerous rabies control activities and was the first to report dog-associated rabies in pigs in Ghana. His sustained contributions to rabies research and control earned him recognition as a featured expert on Global Citizen, where he discussed the global challenge of rabies and the need for its elimination. His professional work integrates veterinary epidemiology, animal health systems, zoonotic disease control, research ethics, and biosafety within human-animal environment interfaces. He has extensive field and institutional experience in disease surveillance, outbreak investigation, livestock health systems strengthening, and agricultural sector administration. He currently holds senior academic leadership positions at the Kwame Nkrumah University of Science and Technology, KNUST, where he contributes to teaching, research supervision, institutional governance, and faculty leadership. Areas of expertise: veterinary public health and epidemiology, animal research, ethics, and welfare. 1. Health and zoonotic disease ecology, biosafety and biosecurity systems, disease surveillance, and outbreak investigation, risk assessment in animal and human health systems. Community-based animal health systems, scientific mentoring and academic supervision, emerging infectious diseases, agricultural sector administration and governance district level program, planning and budgeting, intersectoral coordination, health agriculture, local government. Current appointments: Senior Lecturer School of Veterinary Medicine, KNUST, 2022 to present Vice Dean School of Veterinary Medicine, KNUST, 2025 to present Head of Department, Veterinary Public Health, Food Hygiene, and Food Safety.
Okay. So that is a bio intro of our guest speaker for today, Dr. William Tasiame from Ghana. Before he is given the floor, I would love to just place the ground rules for today's session. Use the Q&A box at the bottom of your screen for any technical questions, and our panel will respond to you. Then you can use the chat box for networking and sharing your thoughts. Any questions you have, you can place them there. A data support and attendance link will be dropped shortly. Get ready for a fast-paced, high-impact dialogue. So with those rules, we now hand over the floor to Dr. Williams.
Yes, thank you. So I titled my presentation Transforming Frontline Rabies, Lesson from Ghana into Smarter World Rabies Day 2026 Preparedness. So on the history of rabies, we all know that over 4,000 years ago, rabies was already known. Despite that, rabies remains a big problem, at least in Africa. The pictures I show here, the top one is about rabies that was depicted like this small maize from Egypt. The down one left is about the fear of people from Germany, and the right down one is also about the first vaccination against rabies, which was in 1885 by Louis Pasteur. Dogs in rural environments, they are parts in Ghana. We need to know the kind of dog population that we have in our communities. In the cities, they are different. Here, these dogs that you see, this picture I took it myself, they guard in the night, but during the day, these dogs are sent to the bush for hunting. So you need to take this into consideration when you are going to do vaccination or any activity on these dogs. I guess in other countries, rural areas, we have similar issue. The illustrations that I have, they are true stories, even though they are illustrations that I mean, but they are true stories. My journey with rabies didn't start in a conference. It didn't start in a laboratory. It started with a boy who was bitten by a rabid dog. This boy I knew was a cattle header. He used to restrain cattle for me to treat them. Later, I heard this boy was bitten by a rabid dog. The parents, they are not the real parents, people who took care of this boy because he came from a poor family. They will go to different communities and be herding cattle. They didn't send this boy to the hospital. Rather, they applied herbal concoction on the wound. 2 months later, this boy started showing clinical signs. Because I had collaboration with the hospital, I was called upon to see what was happening. As soon as I saw the boy and the clinical signs, I told the doctor, this boy is going to die. I knew the boy, so the pain was really excruciating. That was the first time I saw a person going to die of rabies. From that time, I decided to work on rabies. This illustration depicts that rabies is not just a human health issue. This was also in a rural community where we diagnosed the first dog-associated pig rabies, which was published. A rabid dog entered the style of pigs. This style belonged to the old lady. The sow fought this rabid dog, and the sow killed the dog. But during the fight, this pig sustained injuries on the snout, and other pigs got infected with the virus. They all died. I was called upon to go and investigate because it's a rare signs and symptoms in pigs which I had never seen, but through good analysis and good questions from the people around, we got to know that no, this was a suspected rabies case. The pig that died the day I went there, I took the head and told them to keep the body because they didn't want to allow me to take it away for testing. So we agreed that the body will be kept, but I will send the head to the lab. Upon my final diagnosis, then they will know what to do. It was positive for rabies. Later, other pigs died. The woman lost all her pigs. So rabies is not just a human problem, but it can affect livelihoods. The woman lost all her pigs. And this pig that was kept there, the villagers also consumed this carcass. The other one is damp rabies, which is not common. About 20% of rabies could be damp rabies. It can be difficult to diagnose, and we had this difficulty in the rural area as well. That we heard about dogs dying in the community. We went there to investigate, and finally, change of behavior, which is what I try to look at, not just the aggressive nature of these dogs, which is the easiest that people look at. It happened that this dog had the damp rabies. Along the line, 4 people were exposed, potentially exposed from one way or the other. Because we didn't want to take any chance, we recommended that these 4 people should go to the hospital for post-exposure prophylaxis. In fact, they refused because all they knew was that rabies can only be transmitted through the bite of a rabid dog. I had to take them myself to the hospital and talked on their behalf so that they could be given the post-exposure prophylaxis. So at times, it's not just diagnosing the issue on the field, but sometimes one needs to go the long way to find solution to these people. Some of them are afraid, they are shy to go and seek for help. The next image is about the work that I did. Here you will see 3 different places. Adidoma is in the southern part, Agogo in the middle part of Ghana, and Bogatanga is located in the northern part of Ghana. You will see clearly that dogs above 1 year and 3 years for Adidoma constitute the majority part, which is about 85%. The middle zone of Ghana, these dogs also about 80%. But from Bogatanga, you will see that majority of the dogs are juvenile dogs. They are less than 1 year. Something is happening there. Why is it that in this region you have more dogs as juvenile dogs compared to other areas? It happened that this is the place that we have dog trade, slaughter, and consumption. The idea is that if you are going to do vaccination, we cannot use the same method for all the districts, even inside the same country. So this place, if they go and do this annual vaccination that we do on World Rabies Day, it is not going to work because these dogs will be vaccinated this year. The next time you go there, they will be slaughtered and consumed. So there's the need to gather data on these different settings and know what measures or what kind of vaccination regime to apply for different settings, even in our own countries. So this slide is also part of my work. Out of 819 dogs that I sampled, that's the serum samples, it was ELISA. For the southern part that I spoke about, it got about 6.3%, the middle about 3.4%, and Bogatanga, that has more dogs being slaughtered, has 0.7% seropositivity. Seropositivity in terms of the ELISA doesn't mean that these dogs could not be vaccinated, but the idea is that why is it that these places that have more mature dogs are having at least a big higher seropositivity? It means that the way we do the vaccination from these different places should be looked at again. Something needs to change. For the World Rabies Day, for me, we cannot prepare to vaccinate last year's dog population. Each time we should prepare, and the preparation begins even before the World Rabies Day, as we are doing now, 2 months before the World Rabies Day. We know that the stepwise approach that Ghana is also on, that we need to eliminate rabies by 2030. So far, our score is 1.5. 1.5, I would say, is not a good score. It means we are still at the initial stages. Going to vaccinate dogs in the community each year for World Rabies Day, for me, is just like a fanfare. The real work should be throughout the year. Places to be targeted, the kind of vaccinations we should undertake. In fact, the World Rabies Day, I realized that we spend a lot of money to send people from the city, veterinary doctors. They'll be paid hotel, food, transportation, etc. to go to one community, vaccinate a few dogs, take pictures and show it out there. We have vaccinated these dogs. That money could be given to the district vets to do this vaccination throughout the year. So I'm not a fan of the World Rabies Day one vaccination that is seen as a fanfare. It's in the news and people think we are no. We are not doing the right thing. That's my personal opinion anyway. The cross-sector training before the vaccination day, the vets, the medics, the public health, they all need to come together. We have a One Health consortium. Sometimes this consortium or this group or this committee only comes alive when there's an outbreak, when there's an issue, when there's a meeting. We'll go meet, talk. Of course, you'll be paid, hotel, the fund, you'll come back. And I can tell you, it's a lot of money that is spent on this committee. I also attend these meetings. And when the money is given to me, yes, of course, you add it to your family money. But when you go back, for me personally, having seen this boy dying of rabies, in fact, I've seen other children dying of rabies, I think we are just wasting the money of maybe international organization or our money on several meetings when we should rather go to the communities and do yearly. If it's going to be every quarter, vaccination is going to take place at the one point. All we want is the vaccine. People are ready to vaccinate, provided the vaccine is given to them. The district assemblies can help them organize the vaccination, give them water. But the vaccine is all that the veterinarians need to go and do vaccination. The schools, of course, the communities, they need to be targeted, the educational places, the churches, the mosques. Sometimes this is done. In fact, I can go back and tell you that the district at the Dome that you saw about 6.something% of seropositivity, that's where I worked in the past and I left. And we still had a bit higher seropositivity compared to the other communities in Ghana. Why? Because it is not only the laws or the institutions that need to determine how we work. The individuals also need to have that rapport with the health sector. I had a rapport with the health sector at the hospital, so I used to go to them because it happened that the doctors by then they were Cuban doctors and I could speak Spanish. I used to go to them. Any issue that happened, they would inform me that a person was bitten by a dog. Then I would quickly go and investigate. I used to give them the report on the status of the dog before they would go ahead to vaccinate the dog. Because one thing I also see is that we waste the vaccine a lot. People are beaten. They go to the hospital. They say, oh, I was passing. The dog chased me and beat me. Most of the time, these dog bite cases are not suspected rabies cases. So the vaccine gets finished. The person who really needs the vaccine goes and there's no vaccine. That person is likely going to die, or that person has to move to a different community. And because of the expensive nature of this human vaccine, some just do not go and they end up dying in the communities. So as I said, aside the vaccination, we need to take data. So when I conducted some vaccination in the north, I took data. I also took some samples that will help me know how to do in the next year. In fact, that's how I got to know that this region, the dogs are just juvenile dogs. And juvenile dogs will not have received the booster vaccination. You know that the first vaccination that takes place at 3 months, without the booster, it wanes out quickly. So after the 1 year repetition, that the vaccine can be almost lifelong for more than 4 or 5 years. But our dogs also die quicker anyway because of care that we have for them. By 3, 4, 5 years, they will die for either accidents, vehicle hits them, parasites, infection, etc. So at least if these dogs get vaccinated at least twice, the herd immunity will be high in these places. But in the northern part, the herd immunity is not going to be high, it will be always low. So these are some of the pictures. You see that people are enthusiastic to bring their dogs for vaccination, provided you are going to do it for free. This is another one that I was emotional about it. This boy loves his dog so much, he brought his dog for vaccination. The other one, a colleague who helped me to do the vaccination. They were all there and they could handle their dogs. So vaccinating is not a problem, but how to get a vaccine is usually the problem. Thank you. I don't know if I did too. The time.
Thank you very much.
Yeah.
Dr. Shamsia.
Thank you, Dr. Tasiame, for that wonderful pitch. It was incredible and well packed. We are so sorry about the boy that you were familiar with. We will now project the reality from the ground. Please pay close attention to these back-to-back 5-minute video clips. Video 1 covers the outbreak response in Abuja, followed immediately by video 2, which will be highlighting the leader and stakeholder sensitization in Zaria. Control room is over to you now. Please play the videos. Thank you.
My name is Dr. Yvonne Oga. I'm a veterinary doctor and the CEO of Gona Vet Care AgroAlive Limited. We're here today to vaccinate dogs from rabies. As we all know, rabies is a zoonotic disease, meaning it can be transmitted from animals to humans, and we're trying to prevent that. About a month ago, we had a dog that bit a lot of dogs in the community, and we're trying to control an outbreak in this community. So we are very thankful to the organizations that have come together to put this great work together. Thanks goes to the STA, Department of Veterinary. We also want to thank War Against Rabies for coming up with vaccination and investigation of this outbreak.
Well, hello, good morning. My name is Dr. Stephanie. I am a staff of the University of Abuja. We are here giving free vaccinations to dogs, and also creating awareness amongst people of Basa community. With me is Dr. Fat.
I think maybe his network ceased. Can we continue then when it comes back later, after maybe another speaker, we can continue from there. Thank you.
Continue. Okay. So those clips bring out our mission into sharp focus. Let us bring in our frontline state speakers to share their rabies outbreak case studies. Each speaker has exactly 7 minutes. First, we introduce or welcome Dr. Idrissa Yusuf Madaki, the Permanent Secretary, Yobe State Ministry of Livestock Development. I think he will have 8 minutes. So please, over to you, Dr. Idrissa Yusuf Madaki.
Thank you, everybody. Good evening.
Good evening, sir. You're welcome.
Idrissa Madaki, the Permanent Secretary, Yobe State Minister of Livestock Development. I am happy to make this a small presentation on today's topic, Stronger Together on the Front Lines, Transforming Rabies Field Experience into Proactive War Rabies Day Preparedness. This came at the right time because here in Yobe State, we can say that rabies is now become a threatening disease, not only to the human, but to the other animal too. Because from June to July now, we have over 21 cases with 5 confirmed cases of rabies, 3 mortality from rabies cases. So that makes it entirely a kind of outbreak here in the state. With this, thanks to the effort by our field officers who stood firm, providing the needed support, and our One Health team here in Yobe State, which comprises personnel from the Veterinary, Ministry of Environment, and Ministry of Health, who have been providing the needed support, especially in the first incidents where we recorded 5 cases of dog bite from just a single animal. And all these patients were admitted post-exposure prophylaxis, courtesy of the state contributory healthcare scheme. They were all administered post-exposure prophylactic vaccines. They were taken care of in the state teaching hospital as well as specialist hospital. But unfortunately, as God has it, one who happened to be a son to one of our staff died, depicting typical sign of rabies in human. So from this little experience, I can say that we have a great challenge. The challenge is one, we need to have dog ecology. And it is not only our domicile or household dogs that were the threatening dogs, the stray one, that is free moving dogs. We are at a crossroad now. Crossroad in the sense that we have security challenges where certain area might not be reached, and we are at the border, not only national border, but international border, where free movement of goods and services and eco policy that makes livestock movement across our border to be easy. As these animals are moving, the herdsmen used to have some dogs with them, which keep vaccination being provided by the state government during mass livestock vaccination exercise. Those dogs were in the bush, but by way of providence, they used to get into human community. So that makes us to be at the danger. So lack of data on the number of these free moving animals is our greatest challenge. The second issue is the availability of rabies vaccines, which beside the state government, most of these free-moving animals were not taken care of by the owners. That poses another challenge, as not all of them were vaccinated. As such, they were very much vulnerable to be infected from other wild animals in the bush, because they were owned by herders who happen to be on transit now and then. So we can't track them. But whenever we strengthen, from my own perspective, when we strengthen our collaboration with the Ministry of Health and Ministry of Environment, definitely we may be able to map out the vaccination gap areas that we can concentrate on. Similarly, as we see the practical benefit of the teamwork, where our field officers went and reported the case immediately. We contacted the Ministry of Health through the One Health platform. They were able to provide the needed post-exposure vaccination. But supposing we have data on the dogs that were moving freely, definitely such will not have been the case. As such, there is need for us from the livestock component to strengthen our data collection. So that we take it as a challenge. Normally, during mass animal vaccination, where animals were administered PPR, CPPP, black quarter, and other vaccines, we used to spare some of the fund we get to procure anti-rabies vaccines. But it so happened that the coverage and the cooperation we get doesn't transcend the free-ranging dogs, and that still stands a challenge. So there is need for us to intensify our effort. So as such, the World Veterinary Day that is coming should be an opportunity for us to leverage on to improve on our enlightenment campaign and extension coverage. It should be an opportunity for us to bring close to us all stakeholders. They should come with their dogs when not vaccinated, so that during the World Rabies Day, we will launch mass dog vaccination for any member that attended that event. That we can leverage on the danger of rabies, citing the practical experience that we have from this June to July. Hoping that by next month, the number of stray animals, unidentified one, will be reduced, because the herders are moving southward, and that is most of the source of these stray animals. So vaccinating domestic one, which were housed, will continue as usual. Strengthening the collaboration with the Ministry of Livestock, Ministry of Environment, and Ministry of Health. We can utilize the World Rabies Day to strengthen the tie and identify any gaps that is threatening the relationship, so that we can amend it. And we can extend the partnership, not only the three core actors in One Health, but other partners media agencies, local authority, traditional institutions, as well as Ministry of Education to allow us to extend the awareness campaign to people in the schools, not only university, that's tertiary institution, but basic and secondary education. That's the primary school and the secondary school. Strengthening this collaboration and partnership with both government and non-governmental organizations will ensure that there is synergy in data collection, data sharing, and gap identification so that we will make an informed decision while doing or planning subsequent activities. This data will not only be used for planning purposes, but it will answer to us some certain questions of the frequency or the bite in the state, where prevalent in those locations. Encourages community awareness by telling them or comparing them whose dog bite incidence and stray dogs number is lower compared to other places. That can justify why they have low incidence. When the students or the people became aware, the community became aware, reporting to the appropriate authority will equally increase. And when reporting increases, definitely the success rate of not having or reduced incidence of dog bite will be achieved. So now to achieve this, we will equally advocate that each ministry should increase its funding for not only rabies but other zoonotic disease prevention activities. We should equally advocate that the surveillance system will be strengthened. Our security personnel, especially the police force animal branch component, need to key in to support this awareness advocacy to our superiors so that they too can be strengthened on vaccinating their dogs. The same thing with the military. I'm making this reference because here in our area, we interact with them a lot. They used to go to the bush in response to any reported insurgent activities in their own domain. As such, the need for them to be vaccinated, especially the frontliners, need to be considered. So these are some of the areas that need intervention and what we are planning to do consequent upon this incident that happened in Yobe State. Last year, we have recorded some cases, but for this year, the incidence from stray animal is entirely scary. As such, if we are to uphold the concept of togetherness, we can end dog-mediated rabies, we must advocate one commitment this year which is very scary. The state government response. Providing the needed anti-rabies vaccine. Through the media, through engagement. Meeting events, all those will now be strengthened and explored for containment of this incident that is now about to become an annual event. This we learn from experience. And for us to ensure that this term, stronger together on the front lines, definitely the veterinarian incidents or exposure or rabies need to be considered and tailored toward its containment during the 2026 World Rabies Day. Synergy is inevitable. Often from our own area, we have started seeing that from our fellow colleagues. So with this few remarks, I'd like to thank the organizers for this. And I thank everybody for devoting their time to share and listen various field experience so as to plan more during the whole Rabies Day event that is coming. Thank you. God bless you.
Thank you very much, sir. The Permanent Secretary, Yobe State Ministry of Livestock Development, the Honorable Dr. Idrissa Yusuf Madaki. Very insightful.
Thank you.
Thank you very much. So now we'll be playing the short video, and then after that, the bios of the speakers.
Okay.
So the media team. Meanwhile, Dr. Abdullah should be getting ready. The Director of Veterinary Services and State Coordinator of the National Livestock Transformation Plan for Nasarawa State.
My name is Dr. Yvonne Oga. I'm a veterinary doctor and the CEO of Gona Vet Care AgroLife Limited. We're here today to vaccinate dogs from rabies. As we all know, rabies is a zoonotic disease, meaning it can be transmitted from animals to humans, and we're trying to prevent that. About a month ago, we had a dog that bit a lot of dogs in the community, and we're trying to control an outbreak in this community. So we are very thankful to the organizations that have come together to put this great work together. Thanks goes to the STA, Department of Veterinary Services. We also want to thank War Against Rabies for coming up with vaccination and investigation of this outbreak.
Well, hello, good morning. My name is Dr. Stephanie. I am a staff of the University of Abuja. We are here giving free vaccinations to dogs, and also creating awareness amongst people of Basa community. With me is Dr. Fatima.
This is a very deadly disease, but it's highly preventable.
So that's why we're here to educate them and let them know how important this is. So for the prevention, you are supposed to vaccinate your pets against rabies. They take the rabies vaccine to prevent them from getting the disease. So that's basically it. Once your dogs are vaccinated, you don't have issues.
In May and June this year, a rabid dog moved through Basa community, biting animals, spreading fear, and leaving a trail no one saw coming until it was almost too late. A puppy died, a child was reportedly beaten, and by the time the danger was clear, the source of it was already gone. This is why on the 25th and 26th of July, War Against Rabies Foundation returned to Basa not to react, but to protect. Over 2 days, we vaccinated dogs, educated families, and stood alongside a community determined not to let this happen again. Because rabies is preventable, every dog vaccinated is a life protected, human and animal alike. This is part of War Against Rabies Foundation's mission. 70% vaccination coverage, community by community, until Nigeria is rabies free. Basa took the first step. Together, we keep going.
An investigation of this outbreak.
Well, hello, good morning. My name is Dr. Stephanie. I am a staff of the University of Abuja. We are here giving free vaccinations to dogs, and also creating awareness among people of Basa community. With me is Dr. Fatima. This is a very deadly disease, but it's highly preventable. So that's why we're here to educate them and let them know how important this is. So for the prevention, you are supposed to vaccinate your pets against rabies. They take the rabies vaccine to prevent them from getting the disease. So that's basically it. Once your dogs are vaccinated, you don't have issues.
In May and June this year, a rabid dog moved too late. A puppy died, a child was reportedly beaten, and by the time the danger was clear, the source of it was already gone. This is why on the 25th and 26th of July, War Against Rabies Foundation returned to Basa not to react, but to protect. Over 2 days, we vaccinated dogs, educated families, and stood alongside a community determined not to let this happen again. Because rabies is preventable, every dog vaccinated is a life protected, human and animal alike. This is part of War Against Rabies Foundation's mission. 70% vaccination coverage, community by community, until Nigeria is rabies free. Basa took the first step. Together, we keep going.
All right, so we've seen the videos from the field. The next is the bio of our speakers.
Dr. Idrissa Yusuf Madaki was born February 3rd, 1970 in Fika LJ, Yobe State. Attended Garinbald Primary School, Senior Science Secondary School, Biu, Borno State and University of Maiduguri in 1983, 1989 and 1998 respectively. College of Veterinary Surgeons of Nigeria, Fellowship Diploma in 2021 at ABU Study Center, NYSC in Calabar, Vet Clinic in 1999 to 2000. Served as veterinary clinician in Nguru Zonal Office, Area Veterinary Officer in Gashua, Zonal Officer Gaidam, and State Avian Influenza Surveillance Agent in 2000, 2004, 2005, and 2006 respectively. Appointed Head of Animal Health and Program Manager, Yobe State Pilot Livestock Development Program in 2007 to 2020 and 2020 to 2025 respectively. Currently the Permanent Secretary, Yobe State Ministry of Livestock Development. He is happily married. Enjoy reading and farming. NVM, a state secretary and chairman in 2005 to 2009 and 2009 to 2013 respectively. Dr. Abdullahi Musa is a seasoned veterinary professional and dedicated public servant who currently serves as the Director of Veterinary Services and the State Coordinator of the National Livestock Transformation Plan (NLTP) in Nasarawa State. Born on 10th August 1969 in Nasarawa local government area of Nasarawa State to humble parents, his life journey reflects hard work, resilience, and a strong commitment to service. Driven by a passion for animal health and public service, Abdullahi Musa earned his Doctor of Veterinary Medicine degree from Usmanu Danfodio University, Sokoto in 1995 and obtained a master's degree in food animal medicine from University of Ibadan in 2008. In his quest for greater expertise, he was also trained as a field epidemiologist under the USTD Supported Field Epidemiology and Laboratory Training Program (FELTP), where he earned a Master of Public Health (MPH) in Field Epidemiology from Ahmadu Bello University. He is a Fellow of College of Veterinary Surgeons of Nigeria (FCVSN). Abdullahi Musa began his career in the civil service in April 1998, and through years of dedication and professionalism, rose to the position of Director of Veterinary Services. As a consultant with African Field Epidemiology Network, AFENET, he has contributed immensely to disease outbreak investigations and emergency response efforts and has supported immunization activities across the 36 states of Nigeria. An accomplished scholar and researcher, Dr. Abdullahi Musa has authored and co-authored over 10 publications in both local and international journals. He is happily married with children and enjoys animal rearing, traveling, and reading in his leisure time.
Thank you very much, Tolu. So next we welcome Dr. Abdullahi Musa, the Director of Veterinary Services and State Coordinator of the National Livestock Transformation Plan for Nasarawa State. Sir, the floor is yours. 7 minutes.
Good evening, everybody.
Good evening, sir. You're welcome.
I want to start by first expressing my gratitude to the organizers for giving me the opportunity to say my on rabies, Nasarawa State. Rabies is a very serious issue in Nasarawa State, but has been down. Nobody knew about rabies for quite some time. We have not had cases of rabies in dogs. It's not that we don't have, but they are not being reported. But when I came on board, we had to upscale our surveillance and collaboration in such a way that we started having cases being reported. One of the things that really worked for us was collaboration between Minister of Agriculture and Minister of Health, then state veterinary workers and private veterinarians, and sensitization of people, especially in the community. That made us start picking cases of rabies in dogs. So far this year, we have had more than 7 cases involving 15 dogs in the state. Although only one was confirmed to be positive, but there were some cases that were classical, as they had classical symptoms, but we didn't have opportunity to take the dogs for diagnosis. And areas that are affected by rabies in dogs in Nasarawa State cut across both rural and urban areas, among farmers, among herders, in the cities. But we have not had cases of dogs that are being kept in houses as watchdogs. The dogs that don't move around, most of them are dogs that are free. They move from place to place. And, in Nasarawa State, we have very high livestock population, including dogs. Because of the Nasarawa State is surrounded by states that are leading with crisis, conflict between farmers and others and others are coming to crisis. Benue, Taraba, Plateau, Southern Kaduna, Kogi. So there is an influx of people into Nasarawa State with their animals, including dogs. So that affected our even planning during vaccination. Because we plan we have XY number of dogs, but when we go to the field, we have much more than that. And again, the people that are having dogs now, because of the sensitization we do to them, they now have time to come and report. Also, the medical doctors in the hospital that used to be only patient human beings and don't get back to us. Now, once a patient comes to them with case of dog bite, they immediately report to the nearest veterinary officer and the local government DSNO so that we put it in our own record and then try to trace back the case of rabies in the dog. Because before, medical doctors just treat the persons that are affected and forget about the story in dogs. So with the collaboration now, they inform us, we do trace back investigation on the dog and find out and possibly do during vaccination. In Nasarawa State, because of the issues I've told you before, that is influx of people with their animals, vaccination coverage is very poor. Very poor indeed. And vaccination is even inconsistent. The issue we have about vaccination in Nasarawa State, I don't know. Last year we went to buy vaccines as usual, but the prices are more than triple the vaccine. That is now even cheaper to buy foreign vaccine than buying from vaccine. So we budgeted for a number of rabies vaccines that we'll buy. The way we want to buy, the money we could buy, we could not buy more than 50% of what we planned. Because the price had gone up from about 3,000 to 5,500. That is the product. And again, issues we do have about rabies sometimes is accessibility. Many of these dog owners are hunters. And so then when you want to vaccinate their dogs, they will tell you, no, that if you vaccinate their dogs with rabies, the dogs will not catch animals for them. The dog will be lazy, that kind of story. But with time, we are able to bring that kind of feeling among them, but we are still having pockets of those kind of issues. Then transportation too is an issue, because in many cases you vaccinate dogs that are in communities. I mean, before they come. I mean, when we go to that place, you find that people in communities are waiting for you to give them some money to come and get their dogs vaccinated. And that is a big challenge for us. And then another problem we had during the vaccination of rabies in the States is that of perception of people. You know, sometimes when you come, you advise people that they should put their dogs feet and vaccinate them. They don't want to hear that. They tell you that their dogs are supposed to move free, protect them and their animals in their homes. But in that process, the interaction between the dogs and dogs that are not vaccinated is higher, and there is higher chance of transmission of rabies in dogs, among dogs. But so far in the state, we have not had a case of rabies in the last 2 years in humans that are from Nasarawa State. We have had cases in Federal Medical Center, KC, and last year, but those are cases that were referred outside the state. So far, the good thing is that we have not had it in humans. But the good thing about all these ones is about the collaboration we have had now in Nasarawa State, especially the One Health collaboration between Ministry of Agriculture, the Ministry of Health, Ministry of Environment, and the WHO. The WHO have assisted, and the Ministry of Health have assisted us very well, especially in reaching areas to vaccinate dogs. So far, we have had quite a lot of progress in that vaccination because of that collaboration that we're having, unlike what we were having before, when Ministry of Agriculture is the only one that does that kind of thing. And one issue I've discovered in Nasarawa State is that interaction, cases of bites in dogs, especially in rural areas, is more among the kids than the men. Maybe because of the closeness of the children and dogs. But there are more cases of children that are bitten by rabid dogs. I'm not saying those that come down with rabid, some of our friends had one that's come down, but dog bites, we have had plenty. And again, another issue is, because of the paucity of funds and vaccine, we normally do targeted vaccination when we have outbreaks. But the idea is that we should have targeted mass vaccination so that we can cover all the dogs that are available and then do proper enumeration of dogs in the state and other animals. But that is it. And then we do it, but the figures keep changing because people move in with their animals and move out. You plan with people, and then by the time you go to vaccination, they have changed locations to other local governments or to other states, and vice versa. So I think these are our experiences of rabies in Nasarawa State. Thank you very much.
Thank you very much, Dr. Musa, the Director of Veterinary Services and State Coordinator of the National Livestock Transformation Plan for Nasarawa State. I think the central theme from both speakers is the need for collaboration. We'll bring back Dr. Tasiame and Dr. Madaki for a rapid synthesis dialogue. Looking at the Abuja and Zaria videos alongside your Ghana/Nasarawa/Yobe realities, how do we practically bridge current field gaps to achieve an ideal, rapid One Health response? So we need the responses of the three speakers, Dr. Tasiame, Dr. Madaki, and Dr. Musa.
Thank you, moderator, for bringing up this. Sorry, I was a bit busy, so I didn't raise my hand to just start speaking.
Okay.
From my own experience and perspective, one, the gap are enormous, but we can start from a point and then reach our destination in near future. First, dog ecology. This roaming dog, we need to know from where they are coming and where they are heading to. Here, I like to advocate that especially the international routes of livestock movement, there should be a resting point where animals will be made to stop there to rest. During that time, we might have vaccines at hand, then the dogs will be vaccinated. That is not only against rabies, but other transboundary animal diseases that are not endemic in our places. Secondly, community engagement, where the traditional rulers will be involved and sensitized. They should be given a task that are monitorable. Monitorable is that you can trace them, have they delivered or not. Then budgetary provision from government and donors must be enhanced to provide the needed logistics for procurement of the vaccines, transportation, or support to the personnel that were to undertake all this. When this has been done, the rate of reported cases will be increased. Rate of dog bites will be reduced. And the panic or the traditional misconception that when dog bite, there is no treatment in the hospital will equally be wind up. And if that wind up, definitely with the treatment, survival rate from dog bite might be reduced. I might be increased, sorry, not reduced. Death rate will reduce, but survival will increase. So this, from my own perspective, that some of the things that need to be done to contain or reduce rabies incidence in humans.
Okay, thank you very much, sir. All right, so Dr. William Tasiame is around.
Yes, I'm around.
Okay.
Okay, in
So,
addition to what Dr. Micah said, I
yes, sir.
think we have this
Madaki.
VR elimination in the sub-region. For that, they are doing it for all the countries in the sub-region. So it's a risk-based kind of elimination that they are doing. I think for rabies we could make it a sub-regional elimination of rabies. Then inside the countries, I'm of the opinion that the current status that the vaccination is usually in the hands of a central point, which is, let's say, veterinary services department. Then you also have some NGOs and private people doing a bit of free vaccination. Is that the great chunk of the vaccine will obviously go to the veterinary services department, and sometimes because of government things do not move compared to the private. Here, that's how it is, and I believe in other countries too, in Africa, similar thing happens. I think we should have a compartmentalization of rabies elimination. What do I mean by that? The regions that we have in Ghana, we can put them in compartments and have champions. For example, if I'm to take care of rabies elimination in Ashanti region, I need to bring up a plan or a program that will detail how I will arrange the vaccination, how I will get money for the vets who will do the vaccination, how I will do the education, etc. Then I'm giving that region to work on. Later, somebody should be able to check and say, oh, Dr. Tasiame was able to achieve this vaccination rate for this year, next year. But the current vaccination that will be at one central point, then it goes to the districts. Yes, they are there, but the agency that I wish I could see is not there. And these rabies elimination champions do not necessarily have to be people with veterinary services. There could be people in private, there could be people in academia. I think we'll be able to get somewhere if we apply this instead of the current vaccination yearly that we do when there is World Rabies Day. Over.
All right. Thank you very much, Dr. William Tasiame. Now, this question is for you in particular. From your experience, do you think it is difficult for different West African countries to share their rabies data and work together? That's the first question. Second question is, how can universities like the KNUST practically help frontline groups like War Against Rabies Foundation instead of just keeping research in classrooms? Did you get the questions, or should I repeat them?
Yes, I got them.
Okay, thank you.
Yeah, thank you. Yeah, in terms of the collaboration, it's two-way. It could be difficult, but at the same time, it could also be easy. I would say that I've had the experience of working with Dr. Ishaya Teki, Professor Clement Meseko, Dr. Christiana Odita. They are from Nigeria, and a program called One Risk. It was a modeling kind of project about rabies, and we worked together. I was the technical person for Ghana. I was able to share the data from Ghana with them. They also shared their data. Sometimes we had to go to the field and get more data that we inputted into the modeling frame, and we got this paper published. When I finish talking, I will just send a link to the chat box for you to see. So it is possible to do that. It all depends on getting a platform that will bring these people together. And we saw that we had people working on PPR. Some were from Ghana, others were from Nigeria. They are also about to publish their work. So for me, if we were able to do that, it is possible that other areas could also do the same thing. I don't know. I'm currently in academia. I used to be in the district. So, but I still have that rapport with people in the district because I send students to the district for all kinds of things, either treatment, vaccination, be it in rabies, brucellosis, or other things. So I'm still very much seated in the district because people still call me and ask me questions about what happens to their animals in the district, and I do visit at least the district that I worked in the past. I still go there. So it is possible to do that. I think I'm answering the second question together with this one. So what we do in academia, the kind of research that we do, part of it is what I just shared today with you. So I did that as part of my PhD. Then when there is chance for conferences, I do go and share my experience and my results with them. The other thing that we may need to do, which One Race taught us, is to have this policy brief. So for instance, when we finish research, we should feed this policy brief into the veterinary services department. Maybe send a report to the CVO or the director, depending on the country you are. Maybe sending this information to some NGOs, sending to WHO, FAO, who help us a lot in several diseases and co. So by doing that, personally, I share my information with other people. So the cheap talk that you have, I just hope that this is not the first and the last. If I'm needed on any other thing and I have some other person from any country who wants to collaborate, I'm in for it. After all, what do we want? Most of us are coming from the rural areas. So the people in the rural areas, they are the ones who are disproportionately affected. So I want to help these people. Any opportunity that comes, I'm in for it. So I think I've added the two questions together. Over.
Okay, thank you very much. The next question will be addressed to Dr. Abdullahi Musa, Nasarawa State. How can we fit rabies vaccination into the National Livestock Transformation Plan so it gets proper funding? Over to you, sir.
Thank you very much. I want to enlighten you on what National Livestock Transformation Plan is in Nasarawa State. It's a project that was initiated by the former administration of General Muhammad Buhari in 2019. And the primary aim of the NLTP is to transform the way herders rear their animals from nomadic kind of life to kind of ranching. And before during implementation, we had problems. In the original plan, the plan was to spend 100 million naira for 3 states in 10 years. At the end of the day, it was only 1 billion naira that was getting some 100 billion, and for 2 years, for 4 states. So you see, already we have had gap of funding during NNC And the small we had, it was started towards transformation of livestock. It worked well. At least that primary aim had worked well in central states. And that's why, as I told you, there are farmers had that from our neighboring states. In central states, it's always zero. Because that has worked. But central state government, the product finished in 2023. But the central government on its own has continued to shoulder the responsibility of that. And that's why we have this. And we are now expanding, going beyond peace between farmers and herders. We have started vaccinating their animals. We have started sensitizing them on looking for other jobs to do. It's not only cattle rearing that you must do. We have also informed them of improving their breeds from local breeds to other breeds. So in this second phase that we're doing now, we have sort of expanded, which is funded by the national government. We have keyed in vaccination, and we have started with CDTP, TPR, FMG, and definitely rabies. So with time, we definitely put in more funding to NSC. Thank you very much.
Thank you very much, sir. I will now hand over to my co-moderator, student Dr. Shamsia, to give us questions from the chats.
Good evening, everyone. We have had an amazing session. It has been nice and the questions have been answered beautifully. So we have some questions from the chat box. I'll start with the first question from Abdul Wahab Mohammed Karumi. Any of our speakers are allowed to answer. The first question is, what's the probability of ending rabies by 2030? And what role do students play in fighting against rabies? Thank you.
So any of the three speakers?
I say something. Hello?
Yes, we can hear you.
We can hear you. Should I repeat the question?
Yeah, no, I got the question. The probability of ending rabies by 2030 and the role students are supposed to play.
Yes, sir, correct.
I think from what we have had and what we have seen on ground, the probability of ending rabies to zero, as it's been said all the time, by 2030 might not be feasible because it's only 4 years away. And if you look at it, truly, we are still sleeping. It is only now that we are collaborating, we are getting more effort, we are getting more results, especially in the last 5 years. So, for me personally, and from what I've had, what I've read from papers, that is published papers, I don't think that it ended by 2030. I'm not a messenger of bad news, but we can still put in much more effort so that at least we can end it. We can have 2-3 years ahead. I think zero, because up to now, the plan of vaccination is leaving people in the rural areas. Up to date, most of the vaccination activities that are being carried out are mainly in the cities and targeting people that are targeting people that are having dogs in their house, enlightening people. So, as per role of students, I think students have a very good role to play in ending rabies because they are the future of the profession. So, I think the students can start right in the campus, organize World Rabies days, organize sensitization, and not only that, when they go back to their various communities, students can encourage the people in their communities so that they will know that how to own dogs responsibly. It's not a matter of just owning the dog and you are not feeding the dog or you are not keeping the dog in leash. So students have a very important role to play, both in sensitizing people, enlightening people, and also carrying on the church when we are no more there in the profession. Thank you very much. That's my view.
Thank you so much, Dr. Abdullahi. Do any of the speakers want to add?
Okay, so I think you move to the next question.
Okay, I would move to the next question. Thank you for the question, Abdul Wahab. The next question was, okay, the next question was, is it possible, okay, Nanacha Igbokwe asked, is it possible to get stray dogs vaccinated against rabies? And Wanze Nwosu added, who will restrain the stray dogs for vaccination? Will they be vaccinated and released to continue straying? The questions are open to our three speakers. I could repeat the question in case it's not clear.
Yes. Can I?
Okay.
Please go ahead.
Yes, sir.
We are talking about stray animal, how to vaccinate stray animal. Honestly, it's a tax, but it's surmountable. Surmountable in the sense that not all stray animal that come into the population were absolutely straying. Some just leave their owners in search of what to eat, especially from those herders that they are on transit. So getting those stray animal, tracking them to where their owners are is possible. The only difficulty is who will now devote his time to track the animal to where the owner is. That's the difficulty. Two, some of this stray animal can be trapped using nets. When you put them in an enclosure, you can use catching net to hold them. But all these strategies were one time consuming and need devotion from the people that will go and they do the vaccination. That's the difficulty. And I like to take us back a little to first question of achieving zero rabies by 2030. As the speaker said, the truth is it is a realistic projection because the challenge in the rural areas who are in contact with the stray animal is still there. It has not been addressed. Without addressing these challenges, this stray animal will continue maintaining and recycling rabies within the population. Here, the stray animal and the animals that were moving with herders are in the bush, where they come in contact with some other animals that might have been infected, and they get contracting the disease and still transmitting it back to the population. And it's like from all the efforts, nothing tangible put on ground to see that such stray animal contribution to the rabies is addressed. Thank you.
So thank you very much, sir. We will now come to the end of the interactive session. We'll hand the floor back to our convener, Professor Grace Kier, for the official wrap-up. So over to you, ma'am.
Thank you so much, my beloved moderators, Dr. Jerome and Dr. Sansia. Thank you so much for handling this meeting despite the hitches we experienced. And before I get to actually close this meeting, because of the question that was asked earlier, I just want to play this video that we wanted to play, which we couldn't play, because I think it's going to bring in the perspective of the students. Right from when we started, War Against Rabies Foundation started with some of my colleagues and some of my students. So right from the foundation of War Against Rabies, it has always been a student and One Health, people coming together. We had medical doctors, we have biologists, we have, I remember our photographer was a zoologist. So many people coming together. And recently, I had some of my project students who, in continuing with the paper that I published in February, they were able to have some focus group discussion as well as interviews with some of the key community groups. So let me just quickly play the video so that we can also have a bit of what the students did. Oh, sorry. Okay.
Effective public health interventions begin with understanding the communities they are designed to serve. On Saturday, 18th July 2026, under the supervision of Professor Sabo, a team of 3 undergraduate veterinary researchers conducted a community engagement activity as part of an undergraduate research project exploring rabies, other zoonotic diseases, and the One Health approach. The program began with participant registration, followed by baseline interviews and focus group discussions involving traditional hunters, pastoralists, dog butchers, and dog meat sellers. Participants were divided into smaller groups to encourage open and meaningful discussions. Each group included a moderator, a translator, a transcriber, and a recorder. Discussions explored participants' knowledge, beliefs, attitude, and practices regarding rabies and other zoonotic diseases, providing valuable insights into community experiences and behaviors that supports the One Health surveillance. At the same time, baseline interviews were conducted using COBOL tool to access participants' knowledge, attitude, and practices before the educational intervention. The activity concluded with an interactive health education session on rabies prevention, responsible animal ownership, and the importance of the One Health approach. Through community engagement, dialogue, and education, the project reinforced the value of collaboration in strengthening rabies prevention and promoting healthier communities.
So thank you very much once again for being part of our discussion. So that video that the students put together just showed they had an awareness, a sensitization meeting with both the pastoralists, the hunters, the dog butchers, the traditional healers, because based on the research that we did, integrated by case management, we found out that this particular community groups are very key to surveillance, the result of our surveillance, and time will fail me to go back to a lot of the things that we, right from my master's work, 2009, and the findings as to how people actually take many of these dogs that are carrying the rabies virus to these markets. And I'm sure that's part of what the paper also that Dr. Tasiame has shared. So please take some time and read the paper. There are so many papers for my master's work where actually some of the key foundational findings on dog markets are, you can check them on my ResearchGate. for very basic information on dog markets and how its importance in interrupting samples that get to the diagnostic lab for testing. In the Basan local government in Abuja, where the first video that was shared, we found out that there is a particular community in the Basan where they eat dogs, and it's been in addition to the vaccination, we also did dog ecology study in that community, and we also did outbreak investigation, because we're trying to find out the child that was beaten by that dog. And believe me, it's like a mafia. They don't want to let go of the information. And so there is a need for us to really get together with the community and teach them. It has to be continuous, because they will not give in immediately. Sometimes they do, but sometimes it takes a lot for them to give in to what we're trying to teach them. And with time, we'll find out that they cooperate until we have the cooperation of the dog, of the community people, the people that eat these dogs, and the hunters. Believe me, many of the dogs that we want to vaccinate will not be able to vaccinate them. Just like one of the speakers was saying how that, they tell their communities not to bring their dogs for vaccination because they become weak. We had that same problem in Zaria here. So there is a need for all of us to. I'm actually trying to round up. I'm seeing one of our senior colleagues raising his hand. I'm sorry, Adedeji, you could drop your chat, a message in the chat, but this is our senior colleague, and it's only right to give honor to whom honor is due. So let me give Dr. Teki the opportunity to just say something. He's one of our very, very consistent participant and an elder. So we give him, he is also the chief of the National Veterinary Research Institute, VOM. So Dr. Teki, please, you can have the floor. And I also want to appreciate Professor the professor that asked the second question. Oh goodness. All right, so Dr. Teki, please, you can please have the floor quickly, then I'll try and close, because I don't want to keep people too long here, so that next time we call people. Thank you, sir.
Thank you very much, Prof. I'm sorry.
Professor
I thought opportunity.
I remember the name. Sorry, go ahead.
I thought opportunity will be given as usual, but that's why I didn't put my questions on the chat. Can you hear me?
So we can.
Okay, thank you.
Yes.
Thank you very much for putting this program together. It's always very, very good, and very good collaboration grounds, and also bring together much awareness. Regarding Dr. Tasiame's presentation, if I may ask, what is the relevance of the seropositivity you saw in the study regarding protective value of serum antibodies in the blood? And while we advocate for proper way of vaccinating dogs, annual vaccination, because actually the dog population keeps changing, the generation of dogs keeps changing. Before you come the next following year, the dogs are no longer there. But this one, annual vaccination, and we know is the best way. I mean, a regular vaccination, but that has to do with availability of funding. And one of the presenters did say that there's no budgeting for that. So, but meanwhile, while we advocate for that and for responsible dog ownership, we should not just say no to World Rabies Day, what we do annually. We should continue with it while we find appropriate way of protecting all our animals against rabies. And I also want to say to Dr. Abdullahi, we are sorry here in MVRI for the cost of the vaccine. The reason for the hike in price is the cost of production. That is the reason. We did not actually intend to make it difficult for the users, but it is because of the cost of vaccination. thank you very much for all that. May we continue to collaborate and control rabies as much as we can in Nigeria and in West Africa.
Thank you very much, sir. Dr. William, do you want to say a word in response to Dr. Teki before I round up the call?
Okay, yes, I can talk. So, yeah, so the test to check for the immunity of these dogs having the vaccine will be the rapid fluorescent focus inhibition test. But the ELISA is also used in developing countries and in countries that, of course, if you don't have a lot of money, and the other test that I'm talking about is very cumbersome. So as part of my research, I went in for ELISA. It doesn't mean that the results that I have there is totally the issue of these dogs having more immunity than the others, but it tells a story that these dogs in a certain part of the country are very young. So it is obvious that if these dogs are very young, you are likely going to have low seropositivity, which also gives an idea that we need to do something different in these communities. Over.
Thank you very much, Dr. William. And so we, from now till the end of September, we're going to keep having rabies presentations. And so please, we can bring our questions to the next Chip Talk Africa. And believe me, rabies is, if we actually know the enormosity of rabies, then we know that there is actually no room for, I always say this, there's no room for competition. And so I remember even in the Nasarawa state that Dr. Abdullahi was talking about, there was a time they had a problem. The organizations there were not the ones that were reached. There was War Against Rabies so far away that were reached to come and help. And there's a lot to be done in all the states. There's so much work that I keep saying even 10 NGOs are not sufficient. 10 local NGOs are not sufficient to even take care of the problem. So yes, we have international NGOs, but we also have to capitalize on our local, just like Dr. Williams said, our own local people, our local, the academia, the VTHs, the local NGOs, we have to encourage them. If we can't, like, for example, we can't have like a ministry, be it a ministry of health, or we can't have any ministry fighting the local people that are trying to help. It could even be maybe a certain community persons that decide, okay, look, let's do something to help. Let's encourage them. It might be that they might not be so educated in what we know the appropriate way to control is. So what we do is to go and empower them, because there is nothing as strong as having a community-driven intervention. And so that's actually where the awareness campaign is. Well, awareness, outreaches that we do. That's what we're trying to do. We're trying to sell out our passion to ending rabies to the community, so that when they buy it, they can drive it. And when they drive it, failure is not an option. It's not even something that they will consider. I remember in 2019, I have so many stories to tell. Maybe I should just hold my peace till the next Chip Talk Africa. Hopefully we'll make more time, and hopefully we'll have, we plan to have most likely 2 speakers so that we have more time. So wow, what an absolutely phenomenal, deeply enriching session. We have come to the end of July edition of Chip Talk Africa, and my heart is incredibly full, really. We set out today to discuss how we can turn frontline rabies field experiences into proactive preparedness, and we received nothing short of a masterclass. First, I just want to once again extend my deepest gratitude to our esteemed keynote speaker, Dr. William Tasiame, for his unmatched regional insights. I also want to warmly thank Dr. Idrissa, Yusuf Madaki, the Permanent Secretary of Livestock, Department of the Ministry of Livestock in the Yobe state, and Dr. Abdullahi Musa, the DVS, the Director of Veterinary Services of Nasarawa State. Thank you so much for your real-world field experiences, which remind us that, lasting health security actually requires budget advocacy, grassroots trust, and swift One Health action on the ground. To our amazing global audience, we have people that have joined us from Zambia, Cameroon, Ghana. At least these are the few that I took note of, as well as Namibia and Nigeria. Thank you very much. Your brilliant questions. Sorry we couldn't take all of it. And active participation are what really makes this monthly dialogue so vibrant. Please remember that at CHIP, at this Community Health Enhancement Aid Project, CHIP, our foundational rule is just prevention is cheaper than cure. As we count down to the next 2 months to World Rabies Day, please let us carry this spirit of proactive One Health action directly into our communities. It's so important, our communities. Please don't forget also to follow our social media handles for the YouTube replay link. We'll send the videos, and we normally have quite a number of people visiting the YouTube and watching the YouTube because probably they were not able to come here to attend physically, on live. So I know some other people also visit the YouTube for replay of what happened. And also updates on our upcoming, you also get updates on our upcoming community interventions. Please, when you get emails from us, try and open them so that you can know what is happening and what next. Also visit our LinkedIn, Facebook, Instagram, and TikTok, and leave nice comments, constructive comments for us so that you can encourage us, because I tell you, so many of us, we have so many volunteers in over 21 over 21 states now, and they are working so hard. And I think the least we can do is just to say, well done, guys, keep up the good work, and share the link so that they get encouraged to keep working. A special thank you to for the invaluable support from my War Against Rabies Foundation volunteers. Thank you so much to all of you that are really working hard. We really appreciate. I can't tell you how much this means to me. And also for those people in Basan community who, sacrificed to ensure that this weekend we were able to do the 3 interventions, outbreak response, to the Basan community. Thank you so much. I remember Dr. Wanzi, Dr. Yvonne, Dr. Dorothy, so many, too numerous count, Dr. Theophilus, and so many students from the University of Abuja. Thank you very much for joining the fight against rabies in Basan community. On behalf of the Community Health Enhancement Aid Project and the War Against Rabies Foundation, thank you all for joining us. And please don't miss the next edition, because we're bringing in somebody you can't afford to miss listening to. And we're also going to hear a bit from some other states as well. So please do have a wonderful rest for the day and stay safe, and goodbye for now. Thank you so much. God bless you all. Thank you. Thank you.
Thank you. Thank you, ma'am.
Thank you, Prof. Thank you, everyone.
Thank you, sir. Thank you, sir. Thank you, Dr. Tasiame. So guys, you can leave. But Dr. Tasiame, I wanted to just with you small. Ba?
How was it? And thank you for your presentation. For the
Thank you.
You are doing on rabies.
Thank you for the
we
presentation.
Really
yes.
Dr. Taki, how are you?
Thank
Prof,
you.
well done.
Dr. Taki, do you know how I discovered? Dr. Taki, do you know how I discovered Dr. Tasiame?
No.
Well done.
It is Professor Benjamin Mikpe.
Oh yeah, I know him. He was in UI.
You need to have this guy. You need to have this guy come to your platform. I'm like, okay. Oh, let me stop recording. All right. Okay.